Hey everybody, it's Gabriel. We're back here at HIMSS Day 2. I'm here with one of our sales engineers for our healthcare sales team. Why don't you introduce yourself?
Vince Ippolito, based out of Denver, Colorado, sales engineer working exclusively with healthcare providers.
So, Day 2 at HIMSS, lots of activity at the booth. What are you talking to prospects and customers and the folks coming by? What are you talking about?
Yeah, so number one challenge, everybody's trying to figure out how can they spend more time with patients and less time in the physical application. And we're helping bring them automation so they can do just that.
What are some of the common use cases that you're seeing that are where automation and intelligent automation are being applied currently?
Yeah, so you know, there's a handful of clinical use cases that I've been working on with customers to help close care gaps, make sure that physicians are asking the right questions up front to make sure that the patients are actually getting the care that they need. Mm-hmm. And then on top of that, we're doing a lot in the back office with revenue cycle management, with HR, to make sure that our hospitals are running efficiently so that they have the resources to keep their physicians in front of patients.
Interesting. What kind of customers do you work with? Like what size? Are they big healthcare providers, hospitals? Who do you work with?
Yeah, so it's really a broad spectrum. We definitely work with the biggest of the big across the country, but then we also work with a handful of specialty clinics where they might have 1, 2, 3, or 4 clinics across just one minor metro area. So it's really a full spectrum.
Interesting. And So the interesting part of that is with the Cloudnative technology, the Automation 360 platform, it can serve both mid-size, yeah, even smaller potentially, but all the way up to the biggest enterprise level needs. You know?
Yeah, absolutely. The platform has the ability to scale as needed to basically as large as you'd like to go. But the fact that it's cloud native means that you don't have to install this enterprise software, maintain it, manage it within your environment. You don't need to have those technical resources. You can just offload that to our cloud service.
Is there any hesitancy to go cloud? Are there any challenges there?
Yeah, so when you look at any vertical market, healthcare traditionally has been the one that's going to be the most hesitant to go to the cloud just because of the restrictions around PHI. But that's something that we understood up front. We got the necessary certifications. We are the only RPA vendor that is HITRUST certified today, which means that we can host PHI, and our customers don't need to worry about any liabilities of that PHI going places that it shouldn't.